I start with a quick disclaimer. As I talk, I'll round numbers for simplicity, but the data on screen will be more precise. Things may have changed since I recorded this in mid-June. I can't predict the future, but I'll be reading about it when it happens. Hi, it's Health Clips Daily. Let's get straight into the facts about U.S. healthcare and American health. Now, let's talk about the big picture. I believe we can all agree that good health is one of the most important things in life. So I ask, how are Americans' physical and mental health? And how's our healthcare system really working for us? We're here to focus on the facts. You make your own prognosis. There's a lot to chew on. First, America's getting older, and so am I. The median age in the U.S. was only 30 years old in 1980, 35.3 in 2000, and 38.9 in 2007, 2022. In 2022, 3.28 million Americans died, about 1% of our total population. Nearly 3.67 million people were born. And here are the top causes of death per age bracket for 2022. Out of 69 million children ages 1 to 17, just over 16,000 died. About 4,900 of those were from accidents, 2,100 by homicide, and 1,600 by suicide. Out of 120.5 million people, ages 18 to 44, 215,283 died. 83,000 of those were from accidents, including drug overdoses, 22,000 by suicide, 17,000 from heart disease, and 16,000 by homicide. Of roughly 82.5 million people, ages 45 to 64, just over 600,000 died. Around 138,000 from cancer, 118,000 from heart disease, 65,000 from accidents, and 34,000 from COVID. Among the 51.3 million people ages 65 to 84, just under 1.5 million died. About 350,000 from cancer, 319,000 from heart disease, and 93,000 from COVID. And out of nearly 6.5 million Americans over 85, 933,000 died. Around 249,000 from heart disease, 102,000 from cancer, and 73,000 from Alzheimer's. The conclusion from all this: accidents are the leading cause of death between ages 1 and 44. Then cancer takes over at 45, with heart disease a close second. Finally, at 85 plus, heart disease remains the top killer. Let's dig into the leading causes. COVID emerged in 2020, peaked in early January 2021 with nearly 26,000 weekly deaths, but as of July 2024, it's down to only 600 deaths per week. Next, accidental deaths have increased over the last decade, totaling over 227,000 in 2022 and making up about 7% of all deaths. Accidental poisonings, including drug overdoses, are 45% of all accidental deaths. The main culprits are fentanyl and meth. Fentanyl overdoses alone grew from just over 3,000 in 2010 to 74,000 in 2022. One area of improvement: vehicle deaths. In 1970, there were over 52,000 vehicle deaths. Despite the U.S. population growing by 130 million and miles driven nearly tripling from 1.1 trillion to 3.2 trillion, vehicle deaths dropped to just over 42,000 in 2022. Overall, Americans are living longer. Alzheimer's diagnosis has reached 6.7 million people over age 65 as of 2023. We also hear a lot about firearm-related deaths. There were 48,000 gun deaths in 2022, including accidents. Guns are involved in 55% of suicides and 79% of homicides. Active shooter incidents, defined by the FBI, occurred in just 100 cases out of the total gun deaths. Gun-related deaths only account for about 1.2% of all deaths in 1999, rising to 1.5% in 2022. Now, shifting gears, let's talk about key health risk factors: smoking, drinking, and obesity. First, smoking. It causes strokes, heart disease, and lung cancer. It's linked to about 90% of lung cancer deaths and caused roughly 130,000 deaths in 2022. Thankfully, smoking rates have decreased to below 14% of adults. Next, alcohol. Repeated binge drinking increases risks for liver disease and cancers. Nearly 17% of adults were binge drinkers in 2022. Then, obesity. It's defined as having a BMI of 30 or higher. For example, I'm 5'11", weigh 210 pounds, and my BMI is 29.3. Obesity among American adults increased from 15.8% in 2008, 1995 to 33.6% today. This raises risks for cancer, heart disease, and diabetes. Important to note for all of us. Mental health is another big area. Around 34% of young adults, 18 to 25, 28% of adults aged 26 to 49, and 15% of those over 50 report mental health issues. It's clear mental health is a core part of overall well-being. Let's turn to insurance coverage. About 92% of Americans, around 304 million people, had health insurance in 2022. Private plans cover 66%, public coverage 36%, 6%, and the uninsured rate dropped from 16% in 2010 to just 8% in 2022.
Now, on healthcare spending. The U.S. spends $4.5 trillion annually, 17.3% of our GDP. The average cost per enrollee: Medicare, $15,400, Medicaid, $9,200, private insurance, $6,600, and CHIP, $3,400. Most of this, about 80%, goes to personal healthcare like hospital care, physician services, and prescription drugs. Per person, the annual healthcare cost from over $3,000 in 1980 to more than $11,000 in 2022. This increase is largely driven by demographic shifts, especially the rise in our senior population, which grew from 26 million in 1980 to over 57 million today. Most of us pay about $1,400 out of pocket each year, but household contributions, covering premiums and out-of-pocket costs, average nearly $3,700 per person. Premiums alone total around $760 billion annually, with workers paying roughly $300 billion. Adding all this up, premiums, out-of-pocket costs, and other expenses, American households put nearly $1.2 trillion into healthcare each year. That's just under $3,700 per person. Looking at insurers, the administrative costs in 2022 were about $334 billion. Medicare's admin costs are highest, followed by Medicaid, with private insurance costing around $644 billion. One thing that stands out: in 1987, households paid 37% of healthcare costs. Today, they pay 28%. Meanwhile, the federal government's share has increased from 17% to 33%. This shows how much the system relies on government funding now. That's it for health and healthcare. These are complex topics, things that touch all our lives. I hope you see that the more we understand these facts, the better choices we can make. Health Clips Daily is here. Remember, these are just the facts. You decide what to believe. Make sure to subscribe for more quick, data-driven health insights.